But first, it is our nation's largest single health care provider, serving nearly 9 million American military veterans, and it is failing tens of thousands of them, according to a report released today. And that is our big story. Good evening, everybody. I'm Kate Amara. The veterans' health care crisis had lawmakers burning the midnight oil on Capitol Hill tonight. A House panel met to discuss the possible subpoena of records from the VA in connection with the scandal. This comes on the same day an audit across the VA system revealed more than 57,000 vets waiting 90 days or more for a first appointment. Another 64,000 who never got seen at all, with 13% of schedulers ordered to falsify records to cover it all up. And the results of that audit were not pretty for the Baltimore VA system. It's among the worst waits in the country. 11 News reporter George Lettis is live in Rossville in Baltimore County with more on the audit and highlights from a town hall for local vets to weigh in on the problem. George.
Well, Kate, the VA's own audit shows it takes on average about 3 months for a new patient to get an appointment at a VA medical facility in the Baltimore region. Now, if tonight's town hall meeting was any indication, the problem is deeper than appointments.
Klein, U.S. Army, retired.
Retired Sergeant First Class Stephen Klein, 27 years of Army service, says he needed surgery to repair herniated discs in his back. This was in 2005.
I went to the VA, to get it taken care of, and basically they told me, well, we can get you in, but it's going to take you 6 months before we can get you in.
It's one of the many stories we heard tonight from local veterans. The VFW National Office came to Post 6506 in Rossville for a town hall meeting to learn more about the VA healthcare system, which has been under fire for lengthy doctor appointment wait times at its hospitals nationwide. The VA has blamed antiquated record-keeping and scheduling technology, a higher demand from new vets coming into the system, combined with an aging veteran population needing health care more than ever, like retired Vietnam Marine Matt Cochullen.
I went in for the prep. They never did the operation. And that was in 2005, something like that. Here it is, 2014, 10 years. And they still haven't did the operation on my stomach.
These healthcare horror stories come as we learn the VA health system that serves the Baltimore region has the 4th longest hospital appointment wait time average in the country. A federal audit found veterans here wait about 81 days to get a first-time appointment.
And it's a travesty. We have people that could be leaving us in a day. They could be gone in a week, maybe a month, because of their cancer or their issues.
But it's not just new vets trying to get into the system. Most of what we heard at this town hall meeting tonight were complaints from servicemen and women who have been part of the VA for years.
It's appalling. It really is. If General Bradley was alive today, I know he would be really extremely angry.
All right, now back to that audit. It also showed that the wait time for appointments for established patients was much better, an average of 4 days for primary care compared to the 81 days for new patients. We're live in Baltimore County. George Lettis, WBAL TV 11 News.
Thank you, George. Republican Congressman Andy Harris says returning veterans with service-related disabilities should not be waiting months for an initial visit. Speaking today on WBAL Radio, the 1st District rep said other options should be available.
The bottom line is they have to figure out a way to allow our highest priority veterans to just opt out of the VA system, get their care elsewhere.
Also today, more than 20 U.S. senators demanded the FBI step in and investigate.